Diabetes, a chronic condition that affects millions of people worldwide, is a metabolic disorder characterized by elevated blood sugar levels. It can lead to a variety of health complications if not properly managed. One of the most critical aspects of managing diabetes is recognizing early signs and symptoms that require immediate attention. In this video, we will explore 8 diabetes emergency signs you must know to ensure you or your loved ones are well prepared to handle any diabetic crisis that may arise. Number 1. Unexplained weight loss. Unintentional weight loss is a red flag that should not be ignored. It is one of the subtle, yet potentially serious, diabetes emergency signs. Sudden and unexplained weight loss may be an early indication that your body is struggling to process glucose effectively. When the body cannot access glucose for energy, it begins to break down fat and muscle for fuel. This process can lead to significant weight loss over a short period. While it's not uncommon for people to celebrate weight loss, especially if they've been trying to shed some pounds, unexplained weight loss associated with diabetes is different. It often occurs despite an increased appetite, making it all the more perplexing. The key to understanding this symptom is the role of insulin in the body. In individuals with diabetes, the body either does not produce enough insulin, type 1 diabetes, or does not use it efficiently, type 2 diabetes. Insulin is crucial for regulating blood sugar levels and transporting glucose into cells for energy. Without enough insulin or with resistance to its effects, the body's cells are essentially starving, leading to weight loss. Number 2. Excessive thirst. Have you ever experienced that insatiable thirst that seems impossible to quench? While we all get thirsty at times, excessive thirst, medically known as polydipsia, is a common early sign of diabetes. It can be a bothersome symptom, but serves as an important cue for you to investigate further. So, why does diabetes lead to excessive thirst? The root of this issue lies in the high levels of glucose circulating in the blood. When blood sugar is elevated, your kidneys work overtime to remove the excess glucose. In the process, they draw water from your body to dilute the concentrated urine. As a result, you become dehydrated, and your body signals you to drink more fluids to compensate. It's essential to understand that excessive thirst in diabetes is not merely a matter of feeling parched. It's a reflection of your body's attempts to maintain balance. Ignoring this symptom could lead to complications, as dehydration can further exacerbate high blood sugar levels and put additional strain on your kidneys. Number 3. Frequent urination. Another early diabetes sign that often goes hand in hand with excessive thirst is frequent urination, known as polyuria. It might seem like a minor inconvenience, but it's essential to understand the significance of this symptom in the context of diabetes. High blood sugar levels put a tremendous strain on your kidneys, as they need to filter and remove the excess glucose from your bloodstream. This results in more frequent urination as your kidneys work tirelessly to expel the surplus sugar from your body. Polyuria can be disruptive to your daily life, requiring frequent trips to the bathroom. It's crucial to recognize that polyuria is not a random occurrence. It's a manifestation of your body's effort to maintain blood sugar balance. Each time you urinate, your body is striving to remove glucose, potentially preventing further damage caused by elevated blood sugar. While this symptom might not be as alarming as some other diabetes emergency signs, it is a clear indicator that your body is experiencing metabolic stress. Number 4. Fatigue. Living with diabetes can be exhausting, both mentally and physically. One of the most common and debilitating symptoms experienced by individuals with diabetes is persistent fatigue. It's not the kind of tiredness you can simply sleep off. It's a profound weariness that can affect your daily life. Fatigue is often a consequence of fluctuating blood sugar levels in diabetes. Your body relies on glucose for energy, and when blood sugar levels are unstable, your energy levels can also fluctuate. In uncontrolled diabetes, it's common to experience periods of extreme fatigue followed by sudden bursts of energy. Think of it like this. Your body's energy source is like a roller coaster with steep drops and sharp climbs. When your blood sugar levels plummet, you feel drained and lethargic, struggling to find the energy to complete even simple tasks. However, when your body tries to compensate by releasing more glucose, you may suddenly feel a surge of energy, making you feel jittery and anxious. This roller coaster effect on your energy levels can be mentally and physically draining, affecting your mood, cognitive function, and overall quality of life. Number 5. Blurred vision. Diabetes can affect your vision in several ways, with the most common being the development of diabetic retinopathy. This condition occurs when high blood sugar levels damage the tiny blood vessels in the retina, the light-sensitive tissue at the back of the eye. Over time, these blood vessels can leak, swell, or become blocked, leading to changes in your vision. One of the initial signs of diabetic retinopathy is blurred vision. You might notice that your vision becomes hazy or that objects appear out of focus. This blurriness can be particularly prominent after eating a meal or when your blood sugar levels are elevated. For those who haven't experienced this symptom, it's easy to take clear vision for granted. But for someone living with diabetes, any alteration in vision can be unsettling. It's like looking through a foggy window, making it challenging to perform daily tasks with confidence. It's crucial to emphasize that early detection and treatment of diabetic retinopathy can help preserve your vision. Routine eye examinations are essential for individuals with diabetes, as they can identify issues before they become severe. Number 6. Slow healing wounds. The link between slow wound healing and diabetes lies in the damage high blood sugar levels can inflict on the body. Prolonged exposure to elevated glucose can damage blood vessels and decrease blood flow to the injured area. This reduced blood supply limits the delivery of essential nutrients and oxygen required for proper wound healing. Let's imagine a simple scenario. You've accidentally cut your finger while preparing a meal. In a healthy individual, the body's response would include clotting to stop bleeding, inflammation to clean the wound, and the formation of new tissue to close the gap. In a diabetic person, however, this process can be sluggish, leading to prolonged pain and the risk of infection. Consider the impact of this symptom in real-life terms. For a diabetic individual, a minor injury like a small cut can become a major concern, as it can take much longer to heal than in someone without diabetes. The risk of infection, along with the potential for complications, is significantly increased. This makes wound care and vigilance paramount for individuals living with diabetes. Number 7. Numbness or tingling. Numbness or tingling in the extremities, a condition known as neuropathy, is a hallmark symptom of uncontrolled diabetes. It can be a disturbing sensation, often described as pins and needles or a loss of sensation in the affected areas. Understanding neuropathy requires insight into how diabetes affects the nervous system. Elevated blood sugar levels can damage the tiny blood vessels that nourish the nerves, leading to nerve damage over time. This damage can manifest as numbness or tingling sensations, particularly in the feet and hands. Imagine sitting in a chair for an extended period, and when you finally stand up, you experience a temporary sensation of pins and needles in your legs. Neuropathy in diabetes is somewhat similar, but the difference is that this sensation can persist and affect your quality of life. For someone with diabetes, it's like wearing gloves all the time, making it challenging to grasp objects or fully experience the world through their fingertips. In severe cases, neuropathy can lead to a complete loss of sensation in the affected areas, increasing the risk of injuries and ulcers, especially in the feet. Number 8. Fruity breath odor. Fruity breath odor may seem like a peculiar symptom, but it can be a sign of a life-threatening diabetes emergency known as diabetic ketoacidosis. While the name might sound intimidating, understanding its origins can help demystify this symptom. Diabetic ketoacidosis occurs when there is a severe lack of insulin in the body, leading to the breakdown of fat for energy. This process produces toxic substances called ketones, which can build up in the blood. When ketone levels become dangerously high, they can lead to a range of symptoms, including fruity-smelling breath. Imagine the scent of ripe, sweet fruit, like apples or pears, and then imagine your breath taking on a similar aroma. While it might seem pleasant, it's far from ordinary. In the context of diabetic ketoacidosis, this fruity breath odor is a sign of a metabolic crisis. To illustrate the importance of this symptom, Let's consider a scenario where someone with diabetes is unaware of the risks of diabetic ketoacidosis and ignores the fruity breath odor. As ketone levels continue to rise, they may experience vomiting, abdominal pain, and rapid breathing, among other symptoms. Without immediate medical intervention, this can quickly escalate into a life-threatening situation. Diabetes management goes beyond monitoring blood sugar levels and taking medication. It also involves recognizing emergency signs in your body to prevent crisis. Understanding these signals and acting upon them is crucial for effective diabetes management. This proactive approach can help avoid hospitalizations and life-threatening situations. Diabetes care encompasses various elements such as diet, exercise, medication, regular checkups, and emotional well-being. These emergency signs are just one part of this broader journey. Knowledge is a powerful tool in managing diabetes, and communication with healthcare providers is vital to tailor a personalized management plan.